In this video, I'm gonna go over the inversion exercise series. What you need is a resistance band or tube or an object where you're going to apply the resistance in. I have a resistance, this is somewhat of a resistance band. I like this one just to demonstrate, but typically I would use like a TheraBand of some sort. I may not anchor the equipment, but I would show you where I would if I were going to use resistance. Ankle or inversion is where the hip stays still, so I'm not moving my leg as I do this, and my foot goes in this direction. The movement occurs in the back of the part of the ankle, the foot, called the hind foot, specifically the subtalar joint. Now, I can do this action with my ankle in flexion, or also called dorsiflexion, or extension, also called plantar flexion. When you do these exercises, we want the motion to be led here as opposed to the toes. A lot of times people cheat or don't even realize their longer leg muscles that actually attach to the toes rather than along the hind foot and the midfoot recruit first, and it results in a similar, what seems to be the same action but is actually different. So make sure during these exercises your toes either stay relaxed so you don't see like the tendons in the top of the ankle or in the top of the foot, and that this doesn't happen. Especially whenever I say you can do this in flexion. Flexion's this as opposed to that. So let's start with ankle inversion with the foot in extension. You can do this with your legs straight like this, where the resistance is applied. Either it could be, if I'm just pulling my foot in with my foot pointed, I can anchor it here, or I can anchor it here. But I want it to make sure that it's not just straight. It has to be opposing the direction that my foot is moving. I can hold it with my arm, or I can anchor it to something like this rig here. The other thing is, when I move, I'm not moving my whole leg. It's just this part of my body. In this exercise, whenever I'm keeping my foot in the extended position, I'm targeting the tibialis posterior more directly. Also, I can also do this like down and in, and then as I return back to the starting position, I'm controlling up and away, and then down and in, up and away, down and in. So my foot is, instead of just going down and in, like down then over, it's like one smooth motion. So you might have to try just doing in as opposed to that swooping action at first. Where you should feel this is like calf area and this part of the foot, as well as potentially in the underside of the arch. Again, keeping in mind that your toes are relaxed. This can also be done with your foot in flexion. What that would look like is your ankle is pulled up like this, toes are relaxed as opposed to doing this, and you're going like this. So if I had resistance, I think this is easier to do. If I had my resistance anchored to this part of the room that I'm in, I'm gonna pull in, and then I'm gonna control the motion as my foot goes back out. And then I would continue that. This one's harder to do, the swooping action. Again, you're gonna feel it in the same areas, just like on the inside of the ankle, potentially the arch. Now, if you are just getting started and your foot, this area of your ankle is pretty hot, then you might need to start with isometrics. You can do this with your leg, your knee straight or knee bent. doesn't really matter because the muscles that we're using should not be crossing the knee. So I'm gonna, in this case, use my hand, and I'm gonna gently, without moving anything else, especially my toes, press my foot into my hand. Right now my ankle's in flexion. I can also do this like this, so you can see, and do it like that. I like to use something like a wall. I can use my other foot as well. I can do this with both feet at the same time, and trying to feel this in the inside of the ankle. If you have any questions about anything I covered in this video, please comment below or reach out directly. Otherwise, I will see you on the next video.